Mudavadi and our guests. Let's put our hand together for them. Let us remain upstanding as we welcome Sheikh to give us a word of prayer. And before that, we're going to get the national anthem and also the East African anthem. National anthem. National anthem, kindly. Jumuiya Afrika Mashariki, tuwezeshe kuishi kwa amani, tutimize malengo yetu. Jumuiya yetu sote tuilinde, tuwajibike, tuimarike, umoja wetu ni nguzo yetu, jumuiya yetu. Sheikh, tafadhali tuongoze kwa maombi.
In the name of Allah, the most compassionate, most merciful, all praises for Allah, Lord of all worlds, the most compassionate, most merciful, Master of the day of judgment. You alone we worship, and you alone we ask for help. Guide us along the straight path, the path of those you have blessed, not those you are displeased with, or those who are astray. Ya Allah, we call upon you by all your glorious names, Ya Karim, the benevolent sustainer, rectify all the affairs related to our nation. Grant us your blessings and good health, convert our weaknesses into strength, and protect us from all human failures, protect us from all calamities, misguidance, and errors. Grant us complete safety and good health as we trust your hands that take care of us every time. Put your love in our nation and make our people to be obedient to you and to love one another. Make us more conscious, make us more generous, make us more charitable, make us more respectful, make us more knowledgeable, and make us more sincere a people. We pray all this believing and trusting in all your holy names and supplicating for peace and tranquility to prevail upon all your prophets forever and ever. Amen.
Let us be seated kindly. Honorable Wycliffe Musalia Mudavadi, Prime Cabinet Secretary, Ministry of Health, Susan Nakumicha, other Cabinet Secretaries present, Chair Council of Governors and Kirinyaga Governor Anne Waiguru, all governors present, PSs, CASs, business class, and all guests, ladies and gentlemen. With your permission, Honorable Prime Cabinet Secretary, I now invite Mr. Harry Kimtai, CBS, Principal Secretary for Medical Services, to make his remarks and welcome remarks too. A round of applause.
Our chief guest, the Prime Cabinet Secretary, Honorable Musalia Mudavadi, the Cabinet Secretary for Ministry of Health, Honorable Susan Nakumicha, the Cabinet Secretary for East Africa Affairs and Regional Development, Honorable Rebecca Miano, the Cabinet Secretary for Cooperatives and MSME, Simon Chelugui, Excellency, the Governor of KENYA-AFYA, Honorable Anne Waiguru, and also the Chair of the Council of Governors, the Chair of the Council of Governors Health Committee, Honorable Excellency Mudomi Njuki, Excellencies, Governors present, Deputy Governors present, CEOs of various organizations present here, distinguished ladies and gentlemen, good afternoon. It gives me great pleasure to welcome our Honorable Prime Cabinet Secretary who has joined us this evening in this important occasion on the National High-Level Dialogue on Health Financing. The National Health Financing Dialogue is a meeting that brings together stakeholders in the health to discuss opportunities and challenges around increasing domestic processes for health sustainable financing. This dialogue is a follow-up of AU commitments made and adopted by heads of state in 2019 during the Africa Leadership Meeting in investing on health. On the sidelines of the 32nd Ordinary Assembly of the Heads of States and the governments of the African Union, they agreed that they must increase investment in health. And the outcomes of that meeting was to realize the following. One, to increase domestic resources for health, efficient utilization of available resources, to support and accelerate attainment of the universal health coverage. The deliberations of this dialogue, today's dialogue, will present the country's position paper on implementation. So basically, this is a follow-up to the AU resolutions. The paper that is going to be presented here today during this Sectoral Council meeting, this paper that will be gotten here today is going to be presented in the EAC Sectoral Council meeting that will be held in October 2023. Indeed, Prime Cabinet Secretary, the Ministry of Health has made tremendous efforts in addressing existing challenges relating to inadequate financing for key priorities such as human resources, health commodities, infrastructure, and information systems. However, a lot still needs to be done to improve health outcomes of our citizens. Thus, the need for such a forum in advocating for increased investments in health. Prime Cabinet Secretary and the Chief Guest, we are looking forward to the next 3 days where the various stakeholders will have a meaningful and fruitful discussion because we have brought in all the experts, the financials, and the experts in the Ministry of Health to dialogue together and come up with a position paper that will inform the country's decision in terms of investing in health. And this paper, our Chief Guest, will form the country's paper that will be presented to the EAC Sectoral Council in the month of October. Thank you and most welcome. It is therefore now my privilege to welcome our Cabinet Secretary for Health. But I think before I introduce our Cabinet Secretary, I want to request the representative of the AU Commission, who I'm told they are also in the House, to come and give their brief remarks. Yes, Mr. Yilo, welcome. The AU Commission.
I am Professor Julio Rakotunirina, Director for Health and Humanitarian Affairs at African Union Commission. Your Excellency, Prime Cabinet Secretary, ladies and gentlemen, all protocol observed, I am delighted to join you for the dialogue on health financing in Kenya, in this beautiful city of Nairobi. And thank you for welcoming us. Please accept the greeting of the chairperson of African Union Commission and the Commissioner for Health, Humanitarian Affairs, and Social Development at the African Union Commission. They are unable to attend this meeting, but I have to tell you that I'm so happy to be appointed to represent the African Union Commission, because it will be a great opportunity for me as a director in charge of health to learn from your leadership here in Kenya. The African Union Commission supports the optimization of national health financing as a key factor in health and nutrition of its citizens, as outlined in the EU Agenda 2063. The Africa we want. The health and well-being of Africans has been and will continue to be central of our prospects for economic development in Africa. That's why health futures so prominently in the EU Agenda 2063, Africa's blueprint for transforming Africa into a global powerhouse of a future. By extension, the ability to sustainably finance, own, and effectively govern our health programs, disease responses, and health systems is critical to achieving better health outcomes on the continent. Using the resources at our disposal more effectively and efficiently, while working closely with our partners to ensure alignment, is not optional if we are to achieve our health goals. In February 2019, the African Union, with the leadership of the 55 African heads of states, organized the African Leaders Meeting, ALM, investing in health with the support of many partners. This meeting resulted in the approval of a key decision, including the assurance of continued political leadership and action on the issue of national health financing. Globally, the ALM initiative aims to renew continental efforts to translate commitments into measurable actions. The African Union Commission, in collaboration with FDA, NEPAD, and the African Regional Economic Communities, is implementing the ALM agenda. On behalf of African Union Commission, I applaud the East African Community and the Republic of Kenya in particular for this exemplary leadership in ensuring that the debate on health financing takes place at national level with all stakeholders. Allow me, as a representative of African Union Commission, to congratulate the governments of the Republic of Malawi and the Republic of Zambia for organizing the first two national dialogues on health financing on the continent under the auspices of ALM. The African Union Commission looks forward to hearing how holistic engagement with elected officials, policymakers, civil society, and private sectors has helped to advance health financing reforms as well as key lessons and learnings. Let me once again congratulate on behalf of African Union Commission, the Republic of Kenya for organizing this national dialogue on health financing. And I'd like to call on other EU member states in the region and beyond to quickly follow the leadership of the government of Kenya in supporting and implementing the agreements of ALM declaration. I thank you.
Ladies and gentlemen, let's give him another round of applause. The Prime Cabinet Secretary, Chief Guest, allow me then to invite the Chair of the Health Committee of the COG, His Excellency Midomi Njuki. Welcome, sir.
The Cabinet Secretary, the Prime Cabinet Secretary, Honorable Musalia Mudavadi, the CS for Health, and all the other CSCs present, the Chair of Council of Governors, and all my colleague governors present, PSCs, development partners, and all the sagas involved, deputy governors, ladies and gentlemen. For the interest of time, I have been given a speech to read, which I do not want to read, because we all know why we are here. It is simply because of health financing. Health is basically devolved, and as a Council of Governors, we take special interest in the health financing simply because that is where the disconnect is between the reality of what we want or what we desire and what is actually on the ground. Allow me to note the Chief Guest. That is not the first time we have this kind of meeting in Africa. We had one in Abuja in 2001, and we agreed that we upgrade our financing to the health to at least 15%. Recently, we met in Addis Ababa in 2019, February, and you know what we agreed about upscaling the financing. Today, we are here in Nairobi. I don't want to see the same talk, but I believe having gone through it several times, now we have a reason to take it more seriously, because the universal health coverage in Kenya, which has been our dream for quite some time now, in several dispensations of government, including this one of His Excellency William Ruto, the desire to ensure that every Kenyan has a right to affordable healthcare, not only just affordable, but also when it is required. And we note as Council of Governors with a lot of concern that as governments, we have been very focused on the issue of curative, which is very expensive. We wait for our people to get sick. We take them to hospitals. You buy magnificent big equipment that are very expensive. And of course, we pump a lot of money into medical supplies and commodities just to take care of the curative aspect. Yet, if we are to meet our people at the point of need, and that is at the preventive level, we would reduce the queues the number of patients that are flocking our facilities requiring very intensive healthcare because they're already sick. That is why the two levels of government this time, Your Excellency, the Prime Minister, we have agreed that we're going to invest more in preventive at the village level, where we have agreed to pump resources to train community health promoters, empower them to ensure that they have the basic training of our people and follow-up to ensure that we reduce the queues at the hospitals. You'll be surprised from our calculation, we've realized it is 10 times cheaper when we invest in the primary healthcare at the preventive level rather than when we wait for them to come to the hospitals. A very ambitious program that is being rolled out between the Ministry of Health and us as a Council of Governors, and what we call the primary healthcare units, where we've discovered that because of lack of a system that governs how we take care of our patients, we have had a breakdown of systems, and we do not have the category we do not have comprehensive referral system that is guided by principles of diagnosis. You will be surprised that our level 5s and level 6 are congested with patients who have done themselves a self-referral. You have a headache at the village level, you don't want to visit your dispensary because you feel I can only get cured at level 5, at level 6. So you take yourself there, you queue among the others who are very critically sick, and at the end of the day, most people who are critically ill end up not getting justice because they are competing with the ones who just have a flu, they have a headache out of maybe fatigue that would have been cured at the dispensary level. And that is why we welcome, as the Council of Governors, the move by the national government to jointly create a system that has got primary healthcare units that are going to be domiciled at the sub-county level, that do not allow patients to self-check themselves, or rather to self-refer themselves to the county level or the level 5. What that will do is that the most critically ill people will get treatment without a hassle at the level 5s, while we take care of this other level, which is domiciled, or it is anchored on primary, or what we call the CHPs. Initially we used to call them the CHV. CHV is supposed to be the community health workers or volunteers. We have now renamed them. We realize volunteers sometimes don't have a responsibility, and we rename them to promoters, which gives them a self-esteem because they are now promoting health at the primary level. Lastly, Your Excellency, as the Council of Governors, we've realized that our nation has had a very heavy investment by the development partners on the primary health care. Sometimes you'll be surprised that they even invest more than we do as a government. I'm talking about programs like Danida, who have been taking care of our level 2 and level 3. But that funding at all levels, since Kenya has become now a middle income country, it is dwindling. And they know it. We have been having a conversation around it. So what is the solution of a donor-funded system which slowly the donors are pulling out? If we don't invest and match what they've been giving us, it means very soon our system will collapse. We'll be having expectations by our clients, same or even more than before, or higher than before, but we'll be having less resources. That is why we have agreed, as Council of Governors, we must ring-fence all the resources that are realized from our facilities, because from level 4, 5, and 6, it is not free to be treated. They pay But most those resources, because of the law that we have in place, which is well known to the Treasury, all the money is collected at the county level. It does not matter whether it's from a patient, whether it's from a mama boga, all of that money has to find its way back to the Treasury. And then the Treasury allows us to use it again. They channel it back to the counties. Where does it find its way? At that time is not a priority. You are dealing with MCAs who want salary increase, you take the money there, the money that was collected from hospital. You are dealing with bad roads that the community is screaming about every morning. The money that was collected from health facilities find its way to the roads. Do the health facilities make noise? Of course not, they are silent. If you look at the cadre of employees that we have in hospitals, they are professionals, they are very quiet. They give and they don't expect anything back. So what have we done to cure this? We have agreed that all counties pass a law we call Facility Improvement Fund, which basically means all monies collected from the hospitals has to be ring-fenced, and it is supposed to utilize in those hospitals to improve the healthcare in those hospitals. That way, we will be having at least a reduced burden of having to wait for resources from the national government, what we normally call the normal disbursement that you know about, that we always, we are civilized governors, so we don't go to the roads with twigs and say akietu. But we hear it on the media. It may not be by us, it could be by our people. But when we have delayed disbursement, at least the Facility Improvement Fund, which is supposed to sit in our counties in special accounts, or rather what we call special purpose account, will be utilized at the health facilities. To date, out of 47 counties, 25 counties have already passed that bill. It is now an act in most of those counties. We have urged the other counties that are not passed the same law to expedite it, so that by the time we are rolling out universal health care, we will be in a place where we can say our facilities have self-sustainable programs to address health issues. Lastly, Your Excellency, I can see the chairman of National Hospital Insurance Fund here. Out there, 90% of the health facilities in Kenya are public. The people who contribute NHIF mostly are employees of the national government, also the private sector. But you'll be surprised to know, because public facilities also are not very aggressive in reclaiming the National Hospital Insurance Fund refund. 90% of those resources go to the private hospitals, yet the private hospitals are only 10%. 10% is what finds its way to the public facilities. What therefore can we do as a government and as a people to ensure that we have a balance, so that at least what is contributed by taxpayers of government of Kenya can find their way to help very needy people at the village level in our public sector. We have to improve the facilities, we have to be more aggressive, and also, I don't know what can be done, but Bwana Kamau has an idea what can be done, so that we can have more claims by the public facilities rather than the private sector. I have nothing against private sector. My daughter is doing medicine, and Akrama is not to go and serve the public. She wants to do a hospital. So we shall also be having one very soon. But if we don't change that trend, very soon, all our patients will move away from public facilities and they'll end up in a private sector, which is not self-sustainable. With those very few remarks, and with a lot of humility, just in case I did this part of the speech of my boss, which I know she's very sharp, she'll deviate, I beg to surrender. Thank you very much, and God bless you.
Thank you, Excellency. Ladies and gentlemen, join me now in welcoming the Chair of the Council of Governors, Excellency Anne Waiguru. Let's put our hands together for the COG Chair.
My colleague has said everything I wanted to say, but I will try and just sum it up. Your Excellency, the Honorable Prime Cabinet Secretary, Honorable Musalia Mudavadi, the Cabinet Secretary for Health, Ms. Susan Nakumicha, other Cabinet Secretaries present, my colleagues who are here, led by the Chair of the Health Committee at the COG, Governor Muthomi Njuki, the Governor of Meru County, my sister, Excellency Kawira Mwangaza, and the Governor for Elgeyo Marakwet, Governor Wesley Rotich, all other deputy governors who are representing their governors who are here, the PS, State Department for Medical Services, Harry Kimutai, and PS Public Health, Mary Muthoni, national and county government officials, East Africa community representatives, development partners, representatives of civil society and faith-based organizations, members of the press, all distinguished guests, and all protocols observed, good afternoon. On behalf of the Council of Governors and County Governments, I take this early opportunity to thank you for being part of this health financing dialogue. Ladies and gentlemen, as we begin the health financing dialogue, it is important to note that Kenya is undergoing various transitions that need to be considered as we journey towards universal health coverage. Let me point out a few important issues in a very summary format. First and foremost, the demographic transition in Kenya is happening. As fertility declines and Kenyans live longer, we have begun to see a dramatic improvement in the dependency ratio, with the proportion of working age Kenyans growing much faster than the young and elderly populations that depend on them. As such, we need to ensure that our health services are responsive not only to the younger population, but also to senior citizens and other special groups such as persons with disability. Second, the issue of disease profile transitions. Kenya, like many lower middle income countries, face a triple burden of disease, battling communicable diseases amidst a rising burden of non-communicable diseases and injuries. It is worth of note that a shilling invested in preventive healthcare has been found to save 5 shillings in direct medical costs and up to 11 shillings on the overall costs, factoring in other potential losses like individual productivity and caretaker costs. Overall, countries that do not invest in preventive healthcare have been found to spend much more per capita costs for health in both direct and indirect costs. Third, on the issue of donor health aid transition, development partners continue to play a key role in Kenya's health financing landscape, as my colleague has mentioned, particularly in HIV/AIDS, TB, malaria, and other strategic programs. Following the rebasing of Kenya's economy to a middle-income economy in 2015, most donors have started reducing funding support to Kenya. As such, there is need for progressive increment of local resources to health. Fourth, the role of the private sector. Public-private partnerships in which the private partners bring capital are a powerful tool for off-balance sheet financing of public projects. This is especially important when we are operating in a context of restrained fiscal space. We need to embrace private and public partnership more, while ensuring that the options proposed are commercially viable and have acceptable levels of risk to government. Distinguished participants, in light of those above considerations, I will highlight a few county government priorities with regard to domestic resource mobilization. Number one, we intend to progressively increase the health sector budget annually to cover the drop in external financing. Ultimately, we will increase the government allocation. We should work to increase the government allocation to the health sector from the current 11% to 15% in line with the Abuja Declaration of 2001. Further, a model law, as you have been told, of the Facility Improvement Fund was generated by the COG, and county governments have already begun to adopt it. FIF will guarantee that health facilities are able to easily absorb the operational and maintenance costs. 2, that we will work with the national government to implement the President's agenda on health insurance coverage for all, and indeed UHC for all Kenyans. As we do this, we will work towards ensuring that the NHIF reimbursements to public health facilities are predictable, timely, and reliable to allow health facilities to better plan and meet the health needs of the catchment populations they serve. Number 3, that we intend to leverage on private sector investment to health through entering into accountable PPPs. Our request to the National Treasury and to Parliament is that they speedily put in place the necessary legal infrastructure that will facilitate PPPs at the county level. Number 4, that funds such as KENYA-AFYA, Linda Mama, Linda Jamii, and health insurance subsidy programs are expeditiously be disbursed to counties. And number 5, that the financial burden of the human resource for health be discussed and a sustainable solution found. Counties to date continue to bear the burden of cost of specialists who are undergoing training, yet they cannot replace them. Given that the Ministry of Health is responsible for the training of medical officers, the Ministry of Health and the National Treasury need to make provisions in every budgeting cycle for the payment of personnel emoluments for these doctors to allow the counties to replace them and guarantee service delivery. Finally, ladies and gentlemen, county governments are fully committed to providing the highest quality of health services and maximize opportunities for disease prevention, treatment, rehabilitation, and care. That's our commitment. Today, most county governments invest over 30% of their total budgets in health, evidence of their commitment towards the achievement of UHC. We want to thank you for your partnership and support as we continue to walk this journey. Thank you very much. With those few remarks, it is now my honor to invite my sister, CS for Health, Ms. Susan Nakumicha.
Prime Cabinet Secretary, and thank you very much for gracing this occasion as the chief guest. The chair of COG, my colleague, Cabinet Secretary is present, other Excellency Governors present, the chair of NHIF, distinguished guests, ladies and gentlemen. It is my pleasure to host this first National Health Financing Dialogue following the Africa Leadership Meeting Declaration of 2019. Kenya is the first country in East Africa and the third country in Africa to hold this very important national dialogue. Prime Cabinet Secretary, in 2015, EAC mandated the development of a sustainable financing analysis report on universal health coverage with specifics on HIV coverage for the region, following which an enhanced framework of action for all partner states was formulated. This framework was adopted during the high-level ministerial dialogue on sustainable financing for universal health, which called for reprioritization of public spending towards increasing domestic spending on health tax regime efficiency to expand the fiscal space and enable additional investment to health, and minimizing costs through increasing efficiency in service delivery. Towards this, the government of Kenya has put in place initiatives to place the Kenya healthcare system on a sustainable financing pathway. We now have Afya Bora Mashinani, which is a primary healthcare model that focuses on prevention as a resource mobilization tool, and that ensures the continuous increase of disease burden that has continued to make it unsustainable and unachievable to finance health is now reversed. PCS, we are now championing the rollout of UHC through community health promotion, which is largely financed through domestic resources. This focus will move us all from disease firefighting mode towards prevention of disease and promotion of healthcare. Prime Cabinet Secretary, last week we had a very fruitful engagement with the Council of Governors. We are ready to roll out universal health coverage. The government is focused also on strengthening local manufacturing of strategic commodities as a channel for mobilizing resources through efficiency gains that are realized and other key benefits, including enhancing the efficiency by shortening the cycle of procurement, increase the speed at which the finished products get to health facilities. Prime Cabinet Secretary, to address the high cost of health products, the ministry is leveraging on a robust ICT infrastructure to guide on result-based commodity financing with benefit maximized through supply of essential commodities that are aligned to our unique epidemiological context. Economies of scale in purchasing of health commodities and technologies is intended to support the public and private sector to access quality products at competitive prices and eventually pass those benefits to mwananchi. While the government is committed to pooled procurement, the benefits of pooling health products and technologies can be optimized if the East African member states can pool their procurement to attract better price and bring healthcare costs down. Finally, Prime Cabinet Secretary, as a ministry, we are in the process. We have put together legal reforms that are critical for the success and development of a resilient health system. The health legislative agenda, initiated by His Excellency the President, will provide the right environment for sustainable financing and enable rolling out of the primary healthcare agenda, ensuring that we have social health insurance and availability of funds in the facilities and increase efficiency on leveraging on ICT as indicated earlier. Prime Cabinet Secretary, as I stand here, I would like to urge all of us, because I believe we are all stakeholders in health, that we eliminate wastage, which we have witnessed in the recent past, and optimize health resources. I would want to close by thanking His Excellency the President for his focus that he has given to health as one of his key priority agenda. And this is evidence that this would have been the 5th meeting on health had he attended. But due to his nature and the work that is on his shoulders, he has delegated it to you. And I believe you are very passionate on matters health as well. With those few remarks, allow me to now invite our chief guest of the day, His Excellency, the Prime Cabinet Secretary. Welcome, sir.
Good afternoon, ladies and gentlemen. I don't know whether I've come to the rescue of the president or he has come to our rescue. First of all, let me just mention that on his behalf, I was summoned to come and give his statement. So I'll be saying what he would have said had he been here. Maybe not as eloquently, but I'll say what he wanted to say. So as Governor Waiguru has stated and Waziri, he got held up in some other engagements and dispatched me here to make his remarks. So the speech I'm making is not mine, it's his. Your Excellency, Honorable Anne Waiguru, Governor Kirinyaga County, and Chairperson of the Council of Governors, Your Excellency Muthomi Njuki, Governor of Tharaka Nithi and Chair of the Health Committee of the Council of Governors, Your Excellencies Governors who are here, my colleagues who are present, the Chief Executive of the Council of Governors, international dignitaries, distinguished guests, ladies and gentlemen. I stand before you today on behalf of the President of our great nation as a proud representative of the East African Regional Bloc within the African Union. It is an honor to address this gathering on the theme of domestic resource mobilization for health, which is a key priority for my government. A healthy nation is the backbone to prosperity, since healthy individuals can reach their full potential and make economies thrive and communities to flourish. It is therefore imperative that we prioritize the mobilization of domestic resources to ensure the availability of quality healthcare services for all our citizens. As a region, we face numerous challenges in providing adequate healthcare to our people. Limited funding, inadequate infrastructure, inefficiencies, poor regulation in prices of commodities and equipment, and challenges in health workforce in terms of numbers, skills mix, and distribution are among the key obstacles we must overcome. However, I firmly believe that by harnessing our collective resources and working together, we can address these challenges and build robust health systems that serve our people effectively. To affirm our commitment to sustainable financing, the 32nd AU meeting of heads of states resolved to increase domestic resources for health through the Africa Leadership Meeting Declaration of 2019, otherwise known as the ALM Declaration. The heads of states committed to increase domestic funding for health by allocating a significant portion of our national budgets to healthcare provision. By doing so, we demonstrate our commitment to the well-being of our citizens and the long-term development of our nation. Ladies and gentlemen, to achieve this, my government is strengthening the tax systems to broaden the tax base and ensure that our tax laws are fair and equitable. In addition to this, we are investing in digitization of the government systems that will promote transparency, improve efficiency, and combat corruption. By doing so, we can generate the necessary revenue to invest in healthcare infrastructure, procure essential medicines and equipment, and recruit and retain skilled healthcare professionals. several efforts have been put in place to ensure that no one is left behind, including provision of insurance subsidies for the elderly, orphans, poor, and vulnerable, for the pregnant women and children, and high school students in public schools. Treatment of children under the age of 5, that of prisoners and street children, is free in public hospitals. Health services at primary level facilities are also offered free of charge, while management of key conditions of concern, such as HIV, TB, and malaria, are equally free of charge in all public health facilities. With this increase in coverage of services, issues of financial sustainability, efficiency, and quality of care must be addressed. Distinguished ladies and gentlemen, our strong collaboration with other key stakeholders, such as our development partners, civil society, and faith-based organizations, has ensured that their priorities are aligned to the overall government priorities, which is vital for mobilizing resources for health, avoidance of duplication of interventions, and ensuring equity in service delivery. My government has also supported public-private partnerships that encourage private sector investment in the health sector. By leveraging the expertise and resources of the private sector, we will improve service delivery and expand access to healthcare and stimulate economic growth. It has been shown that for every dollar invested in primary healthcare, the return on investment is $16. My government is therefore putting emphasis on preventive healthcare through revamped community and primary healthcare services. For the first time ever, all the 100,000 community health promoters will receive a stipend on a matching basis between the county government and national government. Be provided for a kit to ensure that they are well equipped and to provide services to the community, and a tablet to allow them to keep track of the households under their care in a more effective manner. By focusing on primary healthcare strategies such as vaccinations, health education, and early disease detection and treatment, we can reduce the burden of illness and the associated costs. This, in turn, will free up resources that can be redirected towards strengthening our health systems. Education and awareness are integral components of our strategy. We must educate our citizens about the importance of health and the need to contribute towards its financing, given that 15 million of our country's population is in the informal sector, relative to 3 million in the formal sector. By promoting a culture of health, insurance, and social solidarity, we can ensure that the burden of healthcare costs is shared and no one is left behind. Distinguished guests, I urge each member of our regional bloc to take decisive action in mobilizing domestic resources for health. Let us collaborate closely, but share best practices and learn from one another's successes and challenges. Together, we can build resilient health systems that promote the well-being of our people and drive sustainable development in our region. In conclusion, I am confident that by mobilizing domestic resources, strengthening our tax systems, promoting public-private partnerships, aligning partner priorities to our government priorities, strong collaboration between the national and county governments, and investing in preventive health care, we can overcome the challenges we face in providing quality health care services to our citizens. Let us seize this opportunity to make a lasting impact on the health and well-being of our country, region, and continent. End of statement by His Excellency President William Samoei Ruto. So, ladies and gentlemen, when the president has spoken, you don't say much. But just on a lighter note, just maybe 2 points. One, it's important to note that in this year's budget, 2023-2024, the government has set aside about 141 billion Kenya shillings for the health sector, which is a very may not be enough, but it is quite substantial under the circumstances that we are in. So the government is definitely making a very deliberate and precise statement that this is a sector that must continue to receive all our support as players. The second thing that I can only say is that the private sector must also enhance its footprint in this sector of health. It's not possible for us to just carry this from the taxpayers' money. We will need the support and involvement and partnership of the private sector. So my only message to you this evening is that let us not view the private sector as the opposition in this sector. Sometimes we tend to go to some extreme positions where the private sector are viewed as villains when it comes to trying to collaborate on matters as critical as this. So my encouragement to you is that let us broaden those partnerships and deepen them as much as we will endeavor as government to raise more and allocate more going forward in terms of the public resources that are available from the Kenyan taxpayer. And finally, knowing that there's likely to be perhaps reduced funding in this area from some of our partners because of where we are and maybe some of the things that are happening globally, I think then that special attention of further mobilization of domestic resources for funding becomes extremely critical. I'm sure some of you may have been watching closely the recent summit of the heads of states in Paris. Very powerful statements came from the heads of state who did speak there. The president of Kenya, I think, is it Nguesso, and even Ramaphosa. They made some very, very fundamental statements that require special attention globally, and we ourselves have to know what we can do. And I can flag out specifically when Ramaphosa was talking about how African countries or the least developed countries were struggling to get the COVID vaccinations. You know, he was almost in tears from what I could see. So clearly the message that comes out there is that tears may not move those partners out there. So we might as well roll up our sleeves and see what we can do, because if you think we are going to get some shoulders to cry on, I think it is evident that that is not going to happen very soon.